Happy Friday, Baylor College of Medicine and friends of Baylor. Well, this is the week we've been waiting for. The mask order has been removed, and we'll see what happens. My sister, of course, called all furious because of the, mask order. But you have to take that with a grain of salt because anybody from the Upper West Side of New York is furious about something all the time. So I'll never forget when they stopped doing poppy seed bagels at H&H Bagels. I mean, the whole city fell apart for 2 years. So, you got to take everything from my sister with a little bit. But anyway, I will echo something that Dr. Peirce, who's on our faculty, said. He's the medical director for Houston Emergency Services, and he reminds everyone that the virus is the enemy, not our friends and colleagues in the state of Texas. Let's all focus on the virus, and I think we'll be better off. So, where are we doing with the virus so far? Well, the global summary is pretty bad. There are over 120 million cases, 2.6 million deaths overall, and the U.S., of course, continues to lead with over 500,000 deaths, and Brazil close behind us, and Mexico behind them. So we're still the leaders in that. And the big concern, of course, is that the number of cases have been falling, but not in the last couple of weeks. So we seem to have hit a plateau, and our plateau is right about where we were in late July and August. So we're at a plateau of too many cases, and that makes me very nervous because if we were to have a resurgence, of course, it's on a very big base. And the national state is we're almost 60,000 cases a day. It's a 12% drop from last week. We're down to about 50,000 hospitalized patients, and we were at a peak of 130,000 in January. We're below 2,000 deaths a day, but still very high. And there's some states that are actually doing pretty well. Iowa, Idaho, Ohio, Minnesota, and our friends in Mississippi, who also eliminated their mask order, are remaining pretty low. Cases are high in New York and Florida, Delaware, and in Texas, unfortunately. And interestingly enough, from the beginning of this, there's over 500,000 college kids who've been infected since the fall. And that was we talked about the big surge in the fall, what it was. Well, I still think it was a lot of those kids. And there have been almost 7,000 cases on college sports teams. So the colleges remain a wonderful place for the propagation of virus, unfortunately. And in the state of Texas, we have some hot spots. I was not familiar with Coke County until I saw the numbers. I'm going, what's going on in Coke County? Dallam, Sherman, Hartley counties, real hot spots, Goliad. So I'm not sure what's going on there, but they are having a lot of cases on a per capita basis. Here in Texas, in the Texas Medical Center, we're doing, I'd say, okay. Our number is pretty consistently around 1. We want it to be well below 1. And I think that reflects some emerging variants in the community. We've seen almost now somewhere around 20% of new viruses sequences in the Texas Medical Center in Houston have been the UK variant, which is more infectious. Our test positivity rate is around 5%. That's where we want it to be. We want it to be lower. And we are running about 1,000 cases a day. And remember, we want it to be well below 200, and we're not anywhere near there. And you can see that our weekly average of new cases is really plateaued. You can see that in the 7-day weekly average. And the same is true of our hospitalizations. So it's not going down the way we want it to go down, and I think that's largely based on the fact that we're seeing an emergence of the more infectious variants. And in the United States, the UK variant is really intense in Florida and Michigan and California. We're seeing it in Texas. All of the variants have now been identified in our Houston region, including the Brazilian and the South African variant, although they're not very high. The real one that is emerging is the UK variant, and that's not good because it's, as I said before, it's more infectious. In terms of our vaccination state, we're doing pretty well. We're happy to know that the Johnson & Johnson vaccine did receive the emergency use authorization. We're averaging about 2 million doses per day in the country. 60 million people have received at least one dose of the COVID-19 vaccine. and about 31 million people have been fully vaccinated. So we're getting there, and if you look at the map of the country in terms of intensity, many of the states are doing quite well. West Virginia, Oklahoma, New Mexico, Montana. Texas is lagging behind in the total number of vaccinations. And in the Texas Medical Center in the Houston region, I'm pretty pleased. We're close to 900,000 total doses administered and about 500,000 people fully vaccinated. Remember, to get to 60%, though, we got a lot more vaccinations to do. The good news about the Johnson & Johnson vaccine, though, is that it is very effective. It's hard to compare the Johnson & Johnson to Moderna and Pfizer, because the Moderna and Pfizer vaccines were done mainly in the U.S. at a time before the emergence of variants. The Johnson & Johnson vaccine was done in Europe, but also South Africa, and as a result, the emergence of variants had already occurred, and yet it's still about 72 or 73% effective. So I think as you look at it for just in terms of the effectiveness of these vaccines, they're all going to be about the same. They're all excellent at preventing severe disease, hospitalization, and death. And so I think that's the most important. And the ease of the Johnson & Johnson vaccine with just one dose, and it can be stored for 3 years in a freezer, standard freezer, and can be a couple of months at refrigeration, makes it so easy to distribute. I think it's going to be a real game changer. So very excited about that. It's more likely to be distributed to, pharmacies and grocery stores and places like that in communities with difficult access where, the Moderna and the Pfizer vaccine have to be stored at ultra cold. And so it was obvious that it wasn't going to be easy to distribute that. And remember, we have to be thinking globally also. It can't just be that we're effectively vaccinating the United States. We can't return to normal until the rest of the world is also vaccinated. So that's really, really important. There was an interesting paper that came out in the New England Journal that looked at Israel. Israel's way ahead of all the other countries in the total population being vaccinated. So they looked at real world, efficacy. So it's one thing to do a clinical trial and see, say, 95% effectiveness. It's another thing to actually vaccinate people in the field and see the same kind of level of efficacy. It rarely happens. But this was an interesting study because it looked at 600,000 people in Israel, looked at the Pfizer-BioNTech vaccine, and it turned out it's about 93% effective when done in the field, and it's been very effective at reducing hospitalizations, particularly in the elderly. And so I think we can see in the future that these vaccines are really going to be effective in controlling it. And the other thing that's very positive news is that the Pfizer vaccine seems to be very effective against, at least in neutralizing antibodies to the Brazilian variant, which we're all very concerned about. So again, these vaccines seem to be really effective for the variants as well as the original virus. And it's a race. We've got to get as many people vaccinated as we can, before more infections happen in our community. So let's get back to the mask order, back to Texas. On the positive side, the governor very clearly stated that businesses could require people to wear masks in their own businesses, and also encourage individual responsibility, whatever that is. But those are two positive things if we take them seriously. So let's think about businesses and our individual responsibility. I want to share with you some information that is really kind of striking to me. We talked about the global summary of cases, confirmed cases in the world, 120 million. And if you'll recall, when I said, what are the leading countries? It's the U.S., Brazil, Mexico, U.K., Italy, Russia, Germany, Spain. Those are the leading countries. Why isn't Africa in there? Every single expert I knew was declaring that this particular virus was going to decimate the African continent, absolutely decimate it. Well, when you actually look at it, the entire continent of Africa has only 100,000 deaths. The entire continent, compared to the United States, which has 500,000. So how does that happen? And if you look at that 100,000, 50,000 of them are in South Africa. So in the countries we all expected to be decimated by this virus, they're doing fine. So what accounts for that? Well, really interesting data from the CDC. 85% of the citizens in these countries in Africa believe in wearing masks. So they have been incredibly effective at adopting mask wearing. The other thing that's incredibly interesting is the governments took very quick action. They gave lots of public service information. They effectively isolated cases. And why were they able to do that and we couldn't? Well, they had Ebola before. And nothing will scare you more than Ebola. You get that, you're dead. So they learned very quickly to inform the population. The population participated in contact tracing, something we've never been able to do well because we don't trust the government. And the population adopted mask wearing. So it's really kind of remarkable. The place where we thought would be a disaster has done a much better job than us because they have followed public health measures because they faced these infectious disease crises before. And you can see the advantage of preparation and being ready from a healthcare perspective. The other thing that to me is interesting is the city's been following, states in general in the U.S. In the counties where states have required masks, there has been a dramatic reduction in case numbers. In the counties where they allowed, on-site restaurant dining, indoors restaurant dining, there has been a tremendous increase. And so once again, what can we learn? Well, masks work, being confined in closed spaces make a difference. There also has been a really interesting graph that showed the states that when they adopted mask ordinances, how quickly the virus infection rate was reduced. And in states that allowed on-premise restaurant dining, as soon as they allowed it, it went up. So again, we have evidence for what works and what doesn't work as we now face this new world where it's up to our own individual freedoms and our businesses. So remember last week I talked about the Institute for Health Metrics and the graphs, and I showed these three projections. One was if we were able to implement a 95% mask use, much like the African countries do naturally, we would see case rates fall down to 0 by July. With the vaccine distribution that we're doing currently, and with our current our public health measures, it would be reducing. It wouldn't get to 0, but it would be significantly reduced. And if we went back to pre-COVID-19 world, like get rid of all restrictions, kind of like what we're doing, it just plateaus and stays high for a long time. So that's not where we want to be, and we've got to do better than that. And there was a great analysis actually in the New York Times that I really like. It looked at the how do we get to herd immunity, and it took a looking at vaccination, added to that the people who've actually already been infected, and based on their projections, it looked like by July we would be at about 65% of immunity, which is about where herd immunity would be for this particular virus. But if we stop all restrictions, we get a very paradoxical thing. We reach herd immunity sooner. Why? Because more people get infected. Remember the famous Scott Atlas of Stanford who said, you know what we ought to do? Let everybody get infected, and we will reach herd immunity fast. Well, that's true, except you get a lot of people dying. So if we just let everybody go free and do whatever they want to do now without following public health measures, we'll get to herd immunity sooner. But somewhere between 1,000 and 7,000 people will die from it. So let's not do that. Let's be a lot more intelligent as Texans. And another thing, it's just common sense that really drives me crazy, is the CDC had a wonderful case report of people who decided, things are better, so let's go to a gym and we'll all work out. They had 81 people in a gym. No one was wearing a mask, 55 infections. I mean, really, how stupid can we be to keep repeating the same mistakes and just keep doing the same thing and having the same disasters happen? So, as we think about business responsibility and personal responsibility, I'm pretty sure that the bars that opened up on Washington Avenue and are having mask-off parties and a big drink celebration, that's probably not responsible. I'm just going to go out on a limb. And on the other side of that, HEB continues to require mask wearing. HEB, I think that's pretty responsible. So, I was thinking if I owned a restaurant, what would I do? Well, remember when we had smoking and when people used to object to smoking? Well, we had smoking sections and non-smoking sections. So if I were a restaurant owner, what I would do is I'd say, bring your vaccination card. Have a free drink on the house if you're 2 weeks past your second vaccination or you're 2 weeks past your Johnson & Johnson vaccination. Welcome. And I would have something like 50 to 75% spacing and allow people to sit indoors. The reason I wouldn't go back to normal completely is because the employees probably have not been vaccinated. But that would at least allow some flexibility for people who are vaccinated. If you're not vaccinated, have a seat outdoors, physically distant, enjoy yourself. I think there are some ways that we can be clever and be responsible at the same time. So my message this week is, even though we're free of masks by the order, we shouldn't be free of masks at all. We need to follow public health measures. We need to really double down. With the vaccine rate going as it is, we should reach herd immunity and start being normal sometime in the middle of the summer, unless we blow it. So Texas, let's not blow it right as we're about to cross the finish line. Let's keep going as we are. And this week I want to do a big shout out actually for everybody who has been following my Facebook frame, which is Stick to Science, Mask Up. So everybody keep going what you're doing. Try to be responsible. Don't give up on this. We are really close, but we have to continue our public health measures all the way till the end of this pandemic. So have a great weekend, and I will see you